Dr. Vijaybhasker, orthopedic surgeon, Chairman Ethics Committee Clinical Research. Today we are discussing about orthopedic problems. Usually the people think that the orthopedics is nothing but the bones, but there are the joints, muscles, tendons, ligaments, and many other things connected to bone. So obviously every muscle is obviously attached to the bone, and its tendon, the muscle formation, when it is attached to the muscle is a bone, it will go in the form of tendon and attach to the another bone. So that is called tendon. And then there is a ligaments. Ligaments join the joint. When it joins the joint from one bone to another bone, either of side, with fibrous band, which is called ligament. And then we have a ligaments like anterior cruciate ligament, posterior cruciate ligament in knee, which are most able, toughest ligaments, which are more prone for the injuries, violent injuries, turn to be rupture the tendon, the ligament. So obviously when you understand the anatomical structure and physiological activity of the bone and its ligaments, muscles, and tendons, there are a lot of vasculature and nerves will pass through that. So, obviously, when orthopedic issue comes, the ligaments are more important because whenever there is a trivial injury or the major injury to the joint, these ligaments initially gets damaged. Then sometimes the ligaments rupture themselves. So that is the very important for the joint. When if it is not in contact with the other bone in a proper way, whether it is laxed or tensed or tightened, then there will be subsequently a problem develops in the joint. Whether the pain, swelling, deformity, everything is becomes a problem for the patient because of the ligament damage or diseased. So otherwise, the ligament which is most important is anterior cruciate ligament and posterior cruciate ligament in the knee joint, which is most powerful joint in the body, has to maintain its and the anatomy and physiology in proper way. Otherwise, the patient suffers a lot. So hence this ACL ligament, which is most prone for the injury commonly in the people, because of sports injury or fall from the steps or trivial injury from the walking or any other activity, where there is a rotational injury to the knee leads to ACL and PCL ligament injury. So obviously these ligaments are most important. Even the menisci cartilages in the joints also most important, which vulnerable for the damage or rupture. And then the tendons which are lying either side of the bones attached to one bone to another, which are most physiologically active in human beings in a sports activity or daily day-to-day activities. So obviously when tendons are degenerated, rupture, it develops a lot of problems. Then you have to do the surgical correction of these ligaments, tendons, and the menisci. So the orthopedic has, other than orthopedic, has lot of structures around the bones which are most important to treat or deal. There will be lot of shoulder supraspinatus tendinitis, and there is a periarthritis shoulder. There is a possibility of tennis elbow. There is a possibility of golfer's elbow. There is a possibility of bursa irritation or inflammation. There is a possibility of even the decurvent disease, where extensor brevis tendon of the thumb gets irritated, or there is a possibility of tenovaginitis, there is a possibility of stenosynovitis, and there is a possibility of multiple joint pains. And then in the lower limbs you see there is the possibility of femoral irritation, and then the sciatic pain, and then there is a possibility of knee because of ACL, PCL, and collateral ligament injury, and then there is a possibility of ankle sprain and the respective joint injuries. These are the various problems in the other than orthopedic issues in orthopedics. Thank you.